Um, this is Surya Choday. I was here for my dad, Choday Atchanna. I basically brought him here for heart surgery, hoping that it will be resolved just a simple stent. And Dr. Ramesh is the doctor that I came for the original consultation. Fortunately, I knew one of my cousins is very close to Dr. Ramesh garu, and I heard a lot about him. And I also heard about Dr. Gopichan as one of the best surgeons in Hyderabad. So I found this when I was looking for a very good doctor to treat my father. I always wanted to take him to the number one. And since this is something that's diagnosed only recently when we went for his eye operation, so we just came for a specialist opinion. And since Dr. Ramesh was specialist in the stent procedure, so we wanted to make sure we go to the same person to have the endogram test as well. So if it can be resolved with a simple stent, so it can be treated on the same day. But when Dr. Ramesh performed the procedure, he mentioned it was a very critical condition and he was shifted to ICU. My dad was shifted to ICU. And then we were kind of panicked at that stage. However, once we were shifted to ICU and the doctor executed the procedure, we were kind of comfortable. We are happy that we at least came to know about this in time. And when we are looking for the best surgeon, again I heard a lot about Dr. Gopichan. So we were a little uneasy until we spoke to Dr. Gopichan about the surgery. He was very cool and composed, and one of the things I like with him is he don't have much time. However, he wanted to hear everything about the patient. So he will come straight to the point and ask about the patient during my initial consultation with him. And Dr. Ramesh, there's a lot to talk about him, and he's very good, very composed, and he was always there for us. Whenever I had any questions, even though in spite of his busy schedule, he made sure we know what's going on. So this is so overall we're very happy with about the doctors that treated my dad, especially Dr. Ramesh and Dr. Gopichan, who performed the surgery. So coming to this, since this is where I got my dad operated, I wanted to give some constructive feedback. Hope you don't take this. This is nothing personal against anyone here. I think it's basically the system. But I just want to bring this up since I've been very close to Dr. Ramesh garu as well. So I just want to make sure you take this as a constructive feedback and improve the conditions of services here. So some of the things we faced were originally when we came for the endogram, we were given a package. We went for a separate room package. So after we paid, actually even before we paid, they were aware of the fact that the rooms were not available. However, we paid for the separate room package, and my dad got shifted to a general ward. It's sharing. Again, I'm not complaining about this, but I'm bringing what it is. So in the general ward, the clothing, especially the gowns that the patient was given at that time, there are stains, red stains in there. I'm not sure, I was told it was not red stains since I got scared about that. And they tried to replace that. Sisters were pretty good in there. They tried to help us by replacing the gowns, but almost everything got stains in them. So that's something very inconvenient. I didn't feel that comfortable, especially with that service. However, since I'm more concerned about the patient that time, we just focused on just hoping for the best that time. And then we were told he will be performed endogram test evening on that day, which is 26th of December, Saturday, the day we came here. And after the procedure, we were told he will be shifted to the separate room. But unfortunately, since his condition was diagnosed to be critical, they shifted him over to the ICU. went in the ICU. The same night, I think there was an instance where the duty doctor had explained the risks to my dad, and my dad was little panicked. And I told everyone ahead of time that if there's anything, please call me. I gave my number, two backup numbers. And I also told them that I'll be waiting downstairs, just in case they can't reach me with 1 or 2 calls. I requested him so much, the ICU staff and the security as well. But unfortunately, the next day I came during the visiting hours, and I saw my dad panicked, and I realized he asked the staff to call me when he was planning the other previous night, and no one has informed me. Again, I'm not blaming anyone or any person here, but I think it's just the overall system, and I just wanted to make sure that. So if there's any chance to take care of these things, then it should be helpful for the other patients too. And likewise, there's a couple of things. The staff in general try to help us. However, the security is pretty good. Even though we have got little annoyed little bit because they don't keep sending us every time. But we are happy on the other hand that it's good for the patient if you don't allow them for the ICU every now and then. So the security in general, I like the service. And coming to this overall system, there's no proper coordination between different departments or people within the same department. As an example, I wish the process is a little bit streamlined, and the attendant or the patient were a little more informed and kept in loop whenever, especially about the procedure and all this stuff. So when my dad was to undergo surgery in 2 days, and I had the initial consultation with Dr. G Ramesh, at that point of time I came to know from his attendant, saying we got arranged for the blood donation and all this stuff. Until that point of time, I don't even have the idea that we got arranged for the blood donors. So I kept searching for them, and fortunately I found very nice people who are always willing. So I found them on the social networking sites, and some of my friends as well. So they came over, gave the blood on the next day. But the number that was given to us from the Dr. G attendant, it was 5 + 1 as backup on the next day when the surgery will be performed, and 5 on the previous day to donate the blood. But the number, when we finally went to the blood bank to find out the details, they gave us a different number. Each person gave a different number in there. They said 3 donors are enough in the morning, and then 1 or 2 people as a standby the next day during the surgery will be good enough. So we called people, 3 people came by, they donated the blood, and they left for the day. But and this is very unfortunate. So they said it's all good now. So we got 3 people. So and this another person came in to give the blood, and the person over there said, request him if you don't have a backup for tomorrow, have him come as a backup for tomorrow. So I requested the person who came to donate the blood. He went off, saying he assured us that he will be here tomorrow during the surgery for standby in case for platelets or something. But that particular night, when I visited the manager on duty, thin, tall guy, little bit dark colored guy. So he said, you got arranged for 2 more units of blood. We were a little surprised, and we asked why is that. And then again, I want this to be confidential. I'm not trying to complain against him, but it's not. But I just want to bring this to your consideration, hoping that you'll take care and provide better services. I think you can. So the MOD, he said, when I asked him why do I need 2 more units, when I was told 3 units were enough for this day. So it's me, my brother, and my brother-in-law. 3 of us are here. And he just said, I'm not supposed to say this, but this is what he said to us. I'm not supposed to say this, but 2 of his blood donations didn't work. Those failed the blood test. This is basically what he said. So we got a little panicked and I went to the blood group, and we realized there are two people waiting there because there was an emergency during that day, and they wanted more A plus blood group, and looks like they used our stuff or something like that. So and we realized, fortunately, on the blood group that the blood that was donated for my dad, the three people, that was clean and good. So that was basically a plant life from the body. So again, I'm just telling this. I wouldn't have told this, but since I'm very close to Ramesh Garu, and I have very high opinion on him and Dr. Gopichan, I just want to make sure that these things will be addressed and no other people, because if these flaws are addressed, I think this can be the best hospital. I heard a little bit about this hospital too. Everyone I heard is like, doctors are good, they have the best doctors, however they're a little commercial too. So from my part, what I thought was, even if it's commercial, that's fine with me. I always wanted my dad, to take my dad to the best doctor that's available in here or anywhere in India. And since I heard very high about these doctors, I brought him here. And a general note on the other things too. So the staff here, even though they are very cooperative, almost all the staff. However, I just want to make sure, as a precaution, I saw some people, especially in the sick season, when flu is around, people feeling cold or flu. So I'm hoping that they wear this as a precaution before coming to the patient. It helps them when the staff attend to the patients. It helps them as well as it helps the patients too. So I was actually requesting this every time, and I hope that everyone who comes to visit my dad wears this, just as a general thing. And so I just noticed some people who are not wearing this until the situation is very worse for them. But I wish it's a little sooner. It's better for them as well. So again, so overall I'm very happy with the service, especially provided by the doctors and the staff here. But the other things that I mentioned, please don't take this as any personal complaint against anyone, because I think the system here is influencing them to be part of, to be that way, especially with the blood group as well. Even though they said it's enough first, and then the other patients needed more, so they were trying to put pressure on other patients' attendants like me, who were very soft speaking to them and pushing them for more blood. And the people like MODs have been saying some lies in order to achieve that. And finally, now I'm happy that we didn't even need the blood. Another thing is, the main thing is, I think it's better to keep the patient more informed. So especially I don't even know my dad's blood group until I go to the ICU and ask them for the blood group. They're a little more, what I noticed is they're a little more scared to give us the reports. I don't think there's anything to hide in here. So when the hospital was confident that they have the best doctors and the best system here, why do they have to worry about, giving the reports to patients? Let them take their reports and take a second opinion if they want to. Because I think that should be the path, because I don't have the reports even till today. And I was told that it will be given only during the discharge. That's something I didn't like it. But I hope that can be at best, I don't even know, even though we arranged for the blood group, we just took it, saw it in the file, and I don't have a report in my hand, even today. So, and I also think before or after procedure, it's a little better to keep the patient more informed about how it went, a little more practical. There's no complications, so they don't have to do that, so we are happy. And doctor is here for the rounds. Okay, I think that's pretty much it. And thanks for the treatment and all the services provided.